Hey, this is Garrett with Sympliact. Welcome back to another demo video of the practice side application. This is going to be the second video in this series on looking at provider interactions and provider flows for the delivery and documentation of care during normal patient visits and daily schedules. This video is going to go into a little bit deeper detail on some of the interactions and functionalities available, whereas the first video we sort of went through with some context. We went through some of the flows in more of a real-time interaction of how that would normally happen in the clinic during a daily schedule. So for this video, I'm actually on the laptop instead of the iPad so that I can use the mouse cursor to sort of illustrate as we go and direct your attention. But we're starting in the same place. We're on the daily patient schedule or dashboard. We're going to use the same patient. It's a different thread, but essentially the same flow. Again, just looking at some more of the detail of these interactions. So again, we're on our schedule. We see that we have an appointment at 1 for Jared Jackson. We see currently it's in a scheduled status. We can see some notes about that appointment. If I click on the schedule block like we did on the iPad, same interaction, I get a pop-up modal that shows me some additional detail about the patient, the type of appointment, any reasons that we've attached to the appointment during the scheduling process, and again, any freehand notes that we make. These freehand notes, one note here is that this isn't visible on the patient side, so this is just for internal notes that your office needs to make about the type of appointment or what it's for, or maybe payment status or insurance status, things of those along those lines. Within here, I can update the status. So as the patient's moving through the office, the staff is usually updating these for us. So at this current spot, we're technically at the provider kind of in treatment status. As we've looked at previously, there's some buttons across the bottom. There's an edit button at the top right if we need to edit something about this appointment. So from here, I can choose to go straight to the patient profile screen. If I'm a staff member and I want to look at demographics, insurance information, or make changes there, I could go straight to the health history if I wanted to, or I can go straight to the care thread like we did on the initial video in this series. Notice that it gives us alerts too if one of these sections, health history or patient profile, is either incomplete or not started, or the data is out of date. It draws our attention to maybe something needs to be updated here. But similar to last time, let's go straight into the care thread like we would on a daily patient visit. Again, it takes us to the thread where we can review what's happened on this thread before. In this case, similar to the last case, we've already performed a consultation prior to this current appointment, which is for surgery today. So I can review that past note, I can review my plan, I can review that with the patient to confirm that, again, we're all on the same page and our consent's correct, and just making sure that we're ready to proceed. As I showed on the iPad, on a computer, I can hover over this date, or on the iPad, I can hold my finger over the date. It's going to calculate the number of days since that last interaction, or maybe since the referral came, etc. So one of the ways this is used downstream, if a patient's back in for an implant workup after we've already extracted and grafted, instead of me trying to calculate, okay, how many weeks out are we? I can just easily hover over that date at any time and see exactly where we're at timeline-wise. Okay, so we've confirmed with the patient what the appointment today is for. We're going to go to the health history tab like we did in the last video. So I'm going to click health history. Within here, again, we can see the data that was gathered at whatever the last appointment was. In this case, we've confirmed these sections 2 hours ago, and we were looking at that last interaction. But the way the flow would work with your patient, again, you're going to review to make sure everything's up to date. If it is, we hit the confirm button, but we have the ability to add. We have the ability to see what are the most common predictions. So let's say they tell us today, I forgot to tell you, I'm also allergic to hydrocodone and latex. Very quickly, I can add those to the history instead of manually entering them. And then let's say we'll confirm it from there. As we briefly looked at the last video, I can also see any detail that was added. So in this case, we've got an inactive medicine on the list. I can hide or show that. And I can also show any detail or notes. If I needed more notes or more info, I can click into that entity, add a new note if I want to, dig into more details on the activity period. So in this case, it's calculating for is the patient was on this medicine for about 4.5 years, but it's been inactive for about 3 years. So very quickly and cleanly, I can get to the pertinent data that I want. But again, if for some reason, for what we're seeing them today, I don't really need to know any of that, I start with a clean look so that, again, we're minimizing cognitive load when it's unnecessary and we're keeping a very clean interaction. So let's say this list is still correct. I can confirm it. Similar to what we showed earlier, I can show or hide detail, and then we'll just work through that. One thing we didn't look at the last video too, if I want to, I have the ability to essentially copy or export this data. I can export a PDF if I wanted to, or I can choose, hey, I want to copy that whole history. And you have a detailed, as we'll go back in, I'll have a basic or a detailed. Basic is just going to show me, again, a very clean, we'll click on it, just a clean version of things, none of those contextual notes. But let's say I want, again, to add those contextual notes. I'd hit detailed. So it's going to show me not only the inactive medicine of Fosamax, but it's going to show me that time interval that the patient was taking it. It's not going to just show me diabetes, but it's going to show me, hey, on December 14th, we documented that this is their last hemoglobin A1C, this is their glucose range, so that I have that additional data. And then for either of those, I can just hit copy. It's going to copy that entire history. I can go back to my care thread or an external system or wherever I want to use that data, and I can simply Control V. That entire history is copied in for my documentation or use. So a very quick, easy way to use that data. So we've confirmed the last consultation note with the patient, making sure that we're all on the same page. We've reviewed and confirmed our health history. As we talked about on the last quick video, now we would go into our treatment. In this case, a procedure, or if the patient's there for consultation, whatever the case may be, we're now in the treatment, and we're either documenting the treatment in line with that work or after the case, like we did on the last surgery note. And so during a consultation, some of the documentation is usually going to be occurring during the interaction with the patient. On the procedure or surgery, usually it's going to occur after, like we did last time. But sometimes staff can help us too by pasting in, the appropriate template during the actual case too. But whether the case is that, in this case, the staff is helping us by pasting in the template for us, or we're doing it after the fact, we would essentially proceed like we did in the last video. So I'd paste my template in. I would then update, and not upload, details for this particular procedure. So in this case, and the nice thing about the thread, I can scroll up and find that last consultation. So I'm kind of confirming that what we did is what we had planned to do. I can make any changes that I need to, update the anesthesia. As we showed earlier, I can update this body if necessary, but in this case, let's say it fit with our default body, so I don't need to make any changes there. I can change the follow-up period if I want, like we looked at last time. And then it comes to prescribing. So I can look back at my examination note and see that, hey, the plan was to send some Norco 5s on the day of surgery. But if I also want to double check, there's a feature on the right where I can show very quickly and easily while I'm working here, patient summary. So I can look back, oh, I forgot they're actually allergic to hydrocodone. So we either may send nothing, just stick with ibuprofen, Tylenol, or let's say they say that tramadol works well for them. Maybe we'll send some tramadol in this case. So that quick reference on the right allows me, while I'm working on my note, while I'm reviewing the thread, all in the same place, I can pull up a quick summary to remind myself instead of having to navigate back and forth. So we'll close that. We've got our note complete now, and we can submit it. Another way that that summary can be used, if desired, In this particular template, we essentially just listed in the note, hey, the medical history was reviewed, updated. We have timestamps from our health history interaction when we went through and confirmed those. So that can always be cross-referenced to prove, yes, we did go through that and update and review the medical history as this note suggests. But let's say you don't want that on your template. You want to minimally, document allergies and medicines, let's say. And so let's just do this. So on your template, when it gets pasted in, it's got these sections, let's say. And so the other way you can use that patient summary, if you desire, is at any time there's a copy button similar to how we had on the main medical history screen. So I could come in and say, okay, I want to bring the allergies over. Those get populated. Let's say I want to bring the medications over. So now, very quickly, again, I've leveraged the data that we've already collected, and I can put it directly in my note if I want to. So there's a lot of ways of quickly and easily using that data to make the process as quick and streamlined and remove redundancies as much as possible. Another thing that commonly gets used within the notes themselves is the ability to mention other providers. So let's say, for instance, during this procedure, or when the patient first came in for this procedure today, they mentioned, hey, I've actually got a new thing going on. I've got a tooth on the top left that started hurting recently. You look in there and you see that, there's a fracture, piece of crown, or something has changed on, let's say, tooth 14, and you want to bring the dentist's attention to that. So in line with this procedure note, or you could technically submit the procedure note and just add a new comment in the thread. But let's say you want to bring the collaborating dentist's attention to this procedure that you performed in addition to any changes. So I could hit at Mary Jones at City General Dentistry. I could also mention her practice in general too, so that her staff member get an alert. And then the other thing with the mention functionality, let's say City General Dentistry, I'm not sure that they're constantly on the platform, and I want to make sure they get a notification that, hey, they need to check something in Sympliact. I can elect to send either a text or an email, or technically both, along with this mention, so that if I hit, let's say, email and City General Dentistry, their staff member will get, who's assigned to that account, will get both an email drawing their attention to the fact that you've requested that they check this thread. They'll also get an in-app notification so that when they come to Sympliact after getting that email and they open their notifications panel, they'll see that we've asked them to review a thread. When they click on that notification, it'll take them directly to this thread for them to review what you've put. So, let's say we wanted to let you know that we completed this procedure today, and that Jared also needs to get back in with you guys to evaluate broken tooth 14 for a restoration. And let's say while he was in that day, we took an X-ray of 14 to again further evaluate what was new or going on there. We could upload that to the thread as well. And then another way I'll use this commonly is I will also mention one of my staff users in my practice in line with this. So, hey, could you follow up with City General Dentistry on the above comment issue. So in line with my just normal workflow, I can go ahead and communicate in an asynchronous manner. So it's not like we're trying to get on a phone call about this that may take days because Mary's busy, I'm busy, and it's hard to connect. I can go ahead and document all of this here at the time of my initial treatment. That way we've documented our surgery, our procedure, our appointment, but we've also gone ahead and communicated pertinent pieces of information along the way so that we decrease the number of points needed to communicate these things, both internally and externally, saves time on both ends, gets the patient treated in a quicker, more streamlined manner, and we're sharing data back and forth in a real-time perspective so that, again, everything runs as smooth as possible. We document things, we complete our care in a much quicker, streamlined manner, and we do that all in one interaction instead of now having to circle back to this after the case and such. So those are some of the kind of deeper level details as we looked at previously. I would then go back to the dashboard and I can update the status. Let's say patient's done. We can close that appointment out. If I ever want to see, you can also change your statuses here. So let's say I want to see appointments that I've also closed out for some reason. Say I need to go back and look at one, I can always do that. I can always choose to just show all appointments. So there's ability to change that. It defaults to open so that as you see patients, they kind of fall off the schedule so that it's decreasing again, the cognitive load is decreasing. Distraction, it's only allowing us to focus on what's necessary. You can also change the time intervals. So let's say you want to see the whole day at once. Let's put all those, in this case, there's only the 2 test appointments, or I guess in this case 3. So you can show everything. This is including, so like in this case, this may be like a canceled appointment or something. So you can close everything. You can choose to just see the successful ones, the ones that actually made their appointment and were completed. And then let's say you want to see a little more detail, but you still want a bigger view. Again, you have the ability to expand that out so that it works best for what you're trying to achieve. In this case, we're seeing an even bigger view, but obviously now we have to scroll a little bit. So lots of different kind of features and functionalities there. You can only see your appointments as a certain provider, a bunch of filtering options. So this is kind of a deeper level dive into the functionalities available for your normal daily provider flows. Again, very seamless, very lean, intentionally so that we can be as smart with our time and work as possible, leading to more value for us, more value for the patients. Hopefully this resonates and makes sense. As always, questions, comments, suggestions, reach out to us, let us know. Otherwise, have a great day.